Learning and behavior disorders. History of ADHD. It has been studied for more than 50 years. The APA finally decided on ADHD with 3 patterns of behavior: predominantly hyperactive impulse type, predominantly inattentive type, combined type. Current attempts of defining ADHD must rule out other causes, clinical assessment of development, as well as academic, social, and emotional abilities, checklists, and rating scales. Causes and prevalence of ADHD. There is no absolute cause. Possible causes are genetics, one or more parents is also hyperactive, maternal smoking, or drug-alcohol use during pregnancy may be a factor. Disorders that sometimes accompany ADHD: learning disabilities, oppositional defiant disorder, conduct disorder, anxiety disorder, depressive disorder. Intervention strategies. Medication and behavior management combined seems to be the best approach. Medication. Psychostimulants are the most common. Increase attention and concentration. Decrease impulsivity and activity. It can cause sleep disorders, weight loss, and increased blood pressure. Special diet. The Fingal diet is one tried method. Parents feed the child additive and dye-free foods to lessen hyperactivity behaviors. Nutrition is key, but eliminating foods does not solve the problem. Behavior management. Reward positive behaviors. Evaluate the environment for a match between the environment and the child to manage his or her own behavior. Plan developmentally appropriate activities for all children so that children are not inappropriately labeled. Learning disabilities defined: a disorder in one or more of the basic psychological processes involved in understanding or in using language, spoken or written, which may manifest itself in the imperfect ability to listen, think, speak, write, spell, or do mathematical calculations. It states clearly that a learning disability is not the result of visual, hearing, or motor handicaps, emotional disturbance, environmental, cultural, or economic disadvantage. Second, language learning. Non-disadvantage ruling. This excludes children who live in environmental or economic disadvantage from being labeled learning disabled. Academic ruling. The definition states that there should be difficulty in reading, writing, spelling, and mathematical calculations. At what age? Risk indicators. Predicting learning disabilities. Observation of child. Matching observation to performance measures. Caution. Children can develop skills in a range. Looking for deviations from the range is a sign of possible learning disability. Prerequisite skills. These are skills needed to enter school. Comes through experience, learning, and the opportunity to practice and master developmental skills. Sensory motor difficulties, imperfect body control, poor balance, uncertain bilateral and cross-lateral movements, inability to cross body midline. Faulty spatial orientation, sensory motor difficulties, problems in buttoning, lacing, snapping, cutting, pasting, and stringing beads. Preservation or repeating the same actual word. Cognitive disorders. Trouble organizing thoughts or processing information logically. Abstract thought is difficult. Poor memory. Problems with generalizing information. Visual and auditory perception problems. Visual discrimination. Visual orientation. Visual memory. Visual tracking. Visual motor integration. Auditory perception problems. Language delays. Receptive language. Expressive language. Social skills delays. Bullying, withdrawn, aggressive, overdependent. Response to intervention. This allows a teacher to intervene with a child while there being a required discrepancy between ability and achievement. Tiered approach. Screening and group interventions. Target and short-term interventions. Intensive instruction. Pre-K RTI. High-quality instruction. Tiered instruction and intervention. Ongoing student assessment. Progress monitoring, family involvement. Program considerations. All children will show signs of learning disabilities at one time or another. Children need environments that are positive and developmentally appropriate. Schedules need to be consistent. Tasks need to be broken down into smaller chunks of information. Behavior is extreme, chronic, and unacceptable. Definitional issues. Experts who work with these children prefer the term behaviorally disordered because it places the focus on the observable aspect of the children's problems, the behavior that is causing problems in school and at home. The term emotional or behavioral disorder means a disability characterized by behavioral or emotional responses in school so different from appropriate age, cultural, or ethnic norms that are adversely affect educational performance. Emotional behavioral disorders can coexist with other disabilities. This category may include children or youth with schizophrenic disorders, affective disorders, anxiety disorder, or other sustained disorders of conduct or adjustment when they adversely affect educational performance. Prevalence. 1% of school-age children are identified with serious emotional or behavioral disorders. Behavior problems may be seen in preschool-age children. Intervention imperative when behaviors are becoming a child's habitual way of responding to stress and frustration. Depression. Changes in emotions, motivation, thoughts, and physical well-being. Children growing up with depressed parents are likely to have bouts of anxiety, depression. Low self-esteem may be associated. Anxiety. People who experience excessive fear, worry, or uneasiness. Some fears may even become phobias. Fears are normal, but when taken to the extreme, they can cause multiple maladaptive behaviors. Autism spectrum disorders, usually present by age 3. Deficits in social communications and social interaction. Restricted repetitive behaviors, interests, and activities. Prevalence. More prevalent in boys than in girls. Identification is increasing. More children are being diagnosed by age 3, an overlapping condition that varies from child to child. Advances in autism research, genetic links, mutations seen in children of older fathers, slight association with the mother's age, impact of environmental pollutants, pesticides may increase risk of autism. High levels of air pollutants during pregnancy and first year of life may increase risk of autism. Problems that may accompany ASD, intellectual disability, seizures, Fragile X syndrome, tuberous sclerosis. Other forms of autism spectrum disorder. Rett's disorder, diagnosed predominantly in females, typical development for 18 months, then loss of abilities and gross motor. Speech and hand use, attention deficit hyperactivity disorder. Intervention, applied behavior analysis, discrete trial training, best approaches individualized, other interventions, dietary interventions, food allergies and insufficient vitamins or minerals, chelation, removing heavy metals from bloodstream. Medications used to treat behaviors such as aggression, self-injury, tantrums. Pica, the craving of non-food items, soiling and wetting. Persistent wetting may be a sign of an infection. Child may have an intestinal virus. Diabetics have trouble with bladder control. Strange bathrooms may cause an undue stress on a child. Every child can exhibit behavior problems at one time or another. It is cautioned to not prematurely label a child. It is not how a child is classified, but how a child is cared for that is the most important issue in addressing behavior and learning problems.